And Jeanne has really invested a lot of her time and of her people's time in looking at good models of integrated care across the continuum, both of prevention, of treatment and recovery services. And she really has dedicated a lot of her own resources and her institute's resources to that.
I've spent more years than I want to count for how long this has taken, but I've been working to try and help people get to health care to help improve their health. Physical and mental health go together. I don't think people understand how profoundly they're linked, because what we often don't talk about is really the physical and the biological links between the two. That how your body is feeling has deep connections with how your mind is feeling, and how your mental health is going to have very profound connections on your physical well-being, and it plays out in biochemical ways that I should not be allowed to talk about because I'm not a scientist or a clinician. But you know, if you have diabetes, it's affecting your mental health, and if you have a mental health diagnosis, it's affecting your diabetes. You see a happier patient and you see somebody who gets better faster. The most important thing about integrating primary care and behavioral health is it works. It's effective. People get, their physical health gets better and their mental health gets better, and it's actually a lot cheaper. You don't work on something for as many years as I have without being basically an optimist. And you know, I must have some gene for persistence, because I think it is. I think we are making a lot of progress.
You know, oftentimes a family might push a child forward and says, you know, you need to fix my child. It's never about that, is it? It really is about identifying the issues in a family. And Chris always came to the work at Riverbend with this idea of, you don't fix kids, you work with families.
At times, children's behaviors are seen as kids being bad, and not necessarily being seen as a product of their emotional situation, a product of the environment that they're in. And you know, bad means you just punish. Other things mean that you look at your programming, and you look at your treatment, and you look at your response, and you find ways to do that in ways that are more helpful to the child. Working with children is fun. It's just fun.
Even when they're bouncing off the walls?
Even when they're bouncing off the wall. Currently, I do some work for Northern Vermont University working with interns. And so every once in a while I get somebody that's working with adults and I say, oh, that's so boring. Come work with children. You know, children are where I feel like you can make the impact. You know, there's always something different. Families are all unique in what they bring. I believe that it's places where we can make change, that we can have impact. And you never really know how much impact you have, except that he came back about 4 or 5 years later to talk with me about the impact of therapy and how helpful it was. And so again, it opened my eyes to, you never really know what impact you have.
And she stood up and she was counted. She says, I am the face of mental health. My family has been touched by this. This is who I am. It doesn't define me. It didn't define my sister. But it was something that she lived with. It's something that the whole family had lived with. And to be able to recognize that there's a risk to doing that when there is stigma that exists in a society, and yet still be brave enough to stand up and say, this is an illness like any other illness and we have to deal with it, is one of the bravest things I think a human being can do, and that's exactly what she's done over the years.
I wasn't ready to let her go. I wanted to hear her name, and I thought the best way for that to happen might be to establish a memorial fund. After Beth's suicide, someone suggested to my mother that perhaps her cause of death would be best not discussed. And my mother immediately said, Beth fought so hard to live, and there's no shame in that. It's bad enough or hard enough to deal with the loss of somebody by suicide. So to have that shame taken out of the picture, I think really helped us to heal, and I have to credit my mother with that. Had she not felt that way, had she tried to hide my sister's struggle with mental illness, I wouldn't be here right now. I wouldn't be, the recipient of this award, and I wouldn't have done this work for Riverbend. Instead, I don't know what shape I'd be in, because there'd be the shame that would accompany all of this. I think I'd want people to know that no matter how dark it might seem, no matter how alone you might feel, reach out to someone, and you will get help. There's just a whole team, a whole host, a whole community of people who'll be right there for you, who will help you. I know this, and I believe it.
I think that the selection committee did a fabulous job on choosing people from different realms within the mental health community, that of treatment, that of advocacy, and that of policy. And when those three things come together with powerful individuals like this, it's a force to be reckoned with. And I think, as the Champions Committee recognized, the solution is involving people from all over our community who can play different roles, and then some of their parts are much bigger than their individual contributions. So congratulations to all three of our recipients this year, and you know that you represent an awful lot of people in the community who are doing great work as well. So thank you and congratulations.